Hi everyone, welcome back to another episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer and I work for the Neurologic Wellness Institute. And today's question is, how does sleep affect concussion recovery? And for me, as a clinician who works with many patients with concussion, I am always emphasizing sleep. Sleep is so important for us to fix and normalize first, because if we can fix and normalize sleep, then concussion recovery is most likely going to get better. And I can show you that here with a few articles that we're going to discuss. Sleep is so important to health, not only following a concussion, but all types of health. It can help decrease inflammation. It helps to improve lymphatic drainage, basically drainage that occurs from our brain through our lymphatic system, down our neck, and then into our bloodstream, so that we can then detox it in the liver and get rid of it in our urine and our stool. And so it helps to remove toxins through that lymphatic system, but also helps to rejuvenate, restore, repair. We are not eating during our time of sleep, and when we're not eating during our time of sleep, it is the best time for our cells to undergo autophagy. Basically, they can repair and renew old damaged cells. Same thing with our mitochondria, the powerhouse of the cell. They start to regenerate and become more efficient during sleep. So sleep is so important for everything. If we have poor sleep after a concussion, we need to normalize that first. Sleep is number one most important thing. The other thing I want to show is that the sleep loss or the poor sleep after a concussion may not be new for somebody. They may have had sleep problems prior to, and the sleep or the concussion may not be actually causing the sleep problems in the first place. So sometimes it is, sometimes it's not, but it's really important that we improve the sleep first, okay? So now we're gonna go to the article, and so let's take a peek at the article here. Well, there's three articles, I should say. The first one is one we're mainly going to look at. It is from the Journal of Child Neurology, and it's from 2019. It's the association between sleep quality and recovery following sports-related concussion in pediatrics. And so if we look at the abstract here, we're just going to kind of look through this whole paper. The association between sleep quality and symptom severity and recovery following sports-related concussion in pediatric athletes. That's what they're looking at. They looked at all sports-related concussions less than 18 years old in kids that were around North Texas through a registry. And they all did a Pittsburgh Sleep Quality Index score, which basically the lowest score is 0, the highest score is a 21. And the good sleep quality is less than 5. So I should say the better score is a 0, and the very worst score would be a 21. So less than 5, less than or equal to 5 is good sleep quality. Higher than 5 is poor sleep quality. The poor sleep quality group reported a higher median total symptom score at 3 months of follow-up, and it took them a median of 2 weeks longer to recover than the good sleep quality group. Poor sleep quality is also strongly associated with greater symptom severity and a longer time to recover. And so therefore, their conclusion is early recognition of concussed athletes with poor sleep quality at the initial visit is very, very important and may help predict a prolonged recovery. It's important because we need to fix the sleep first to help and therefore prevent that prolonged recovery. And so as we look at this article, again, this is the Pittsburgh Sleep Quality Index, good quality sleep versus poor quality sleep. Again, it's asking the children about sleep quality, subjective sleep quality, sleep latency, so the length, sleep duration, this is sleep onset latency. So basically, how long does it take you to get to sleep? Sleep duration is the time sleeping, sleep efficiency, sleep disturbance, use of sleep medication, and daytime dysfunction. In the results, there were 517 participants, 277 were male, 240 were female. The median age was 14 years old. There were 72% of these concussion athletes or concussion kids that had a poor sleep quality. Okay. had a good sleep quality, the GS group. So 72% were in the good sleep group, whereas the remaining 27% or 141 participants had scores higher than 5, so they were in the poor sleep quality group. In general, the poor sleep quality group was older, okay, so like 15 years or, generally older on average. They had a higher proportion of females, higher previous diagnosis of psychological disorder, a previous history of headaches or migraines, a previous brain injury, and they all took medication, right, and generally more often took medication prior to or for sleep prior to the injury. So again, some of these pre-existing conditions might not mean that the concussion caused certain conditions and caused the poor sleep, but they already maybe had poor sleep coming in. And so of note, the poor sleep group reported sleep disturbances about 28% of the time, once or more a week, while the good sleep, only 3.7% of that group reported sleep disturbances once or more per week. More on just looking at the more evidence here, right? So more were in football or soccer or basketball, were the highest amount. So the 3-month follow-up, this is the important part. So the poor sleep group took longer to reach symptom resolution than the good sleep group. The good sleep group also reached symptom resolution within 14 days of injury, more often, 45%, versus the poor sleep group, only 17 reached it within 14 days. Whereas 48% of the poor sleep group took more than 1 month to recover from the concussion, versus only 25% took more than 1 month. Then they also looked at the 14 to 18-year-old group, and the 14 to 18-year-old group had more likely that they were going to have poor sleep in the normal recovery group. So basically, the ones that recovered normally, 244 participants were considered normal recovery, with 150 of them being male, 93 being female. In this group, 210 of them were in the good sleep group. So 86% of the ones that recovered normally were in the good sleep group. I'm pretty sure that was within 14 days, whereas the remaining 33 were in the poor sleep group. So again, we do know that here good sleep can then definitely improve recovery from a concussion. If you have poor sleep, chances are you're not going to recover within that normal period. It's only a 13% percentage that you're going to recover within 14 days. So they go through the whole discussion, basically talking about how important sleep is and how sleep is for proper resolution. And so that's just that article. It's an important article. I just want to show the abstract of this one. This one was collegiate athletes, so the last one was more pediatric, so high school and younger. This one's collegiate athletes. It's looking more at the sleep time, so not necessarily sleep quality. We do know that duration, we don't necessarily need a long duration of sleep. We just want good sleep quality. And so it's, again, influence of post-concussion sleep duration on concussion recovery in collegiate athletes. This article is from 2017 down here. And so again, they looked at people within 24 to 48 hours and then daily until symptoms recovered. They looked at, did they have shorter sleep, no change in sleep, or longer sleep after the concussion. The shorter sleep group had a greater symptom severity than no sleep change, and longer sleep groups at 24 to 48 hours and at 2 to 4 days, but it didn't really affect them longer down the road. They also had slower impact reaction times. So basically, impact is a concussion study or a concussion tool to test reaction times. The people that had poorer sleep, the participants, the athletes that had poorer sleep, also had poorer reaction times. So again, now this poor sleep is also based on duration. So we do know that you can sleep a long time and not have good sleep quality, and that can affect your overall the overall association between concussion recovery. This is why the first article was probably a better termed article, but I just wanted to show this one because it is from collegiate athletes and how sleep affects concussion. And so the last article that I want to just take a peek at is, why is this happening? And so we know that, as I mentioned in the beginning, that sleep is important in order to decrease waste from the brain, or to to improve the lymphatic system to remove waste coming from the brain. Well, when a concussion happens, we have a lot of inflammation occurring in the brain, and we need to not only support the body with proper nutrition to decrease inflammation, but we also need to get rid of the toxins that are in the brain, the inflammatory cytokines that are basically promoting inflammation. Any dead or damaged cells, we need to get rid of them. Again, the mitophagy and the autophagy portion, so repairing cells that are working, neurons or brain cells that are working well. And so here we have an article showing how acute sleep loss, so basically staying up all night, can greatly increase the amount of a protein, a biomarker that is common in Alzheimer's and Parkinson's and CTE or chronic traumatic encephalopathy. And so this is showing that when you stay up all night and you don't sleep, you don't have proper drainage or lymphatic drainage, and you also may have actually a more production of these molecules that can damage the brain, and that can again further cause problems with concussion recovery. So in this article, it's from Neurology in 2020. Again, the effects of acute sleep loss on diurnal plasma dynamics of CNS health biomarkers in young men. So they took 15 young healthy men. They either they did it in a randomized order. So at one time they had them sleep the whole night, and they checked their before and after blood markers. And then one time they had them stay up all night, and then before and after blood markers. What I really liked about the study, which we won't go over all the methods, but I liked that they had them sleep in a lab before the study, so it wasn't like a brand new task before they ever even tested them. They also controlled for many variables during it. Okay, so yeah, normal sleep or overnight sleep loss. They measured total tau. They measured amyloid beta 40 and 42. These are common in or commonly increased in Alzheimer's disease. Neurofilament light chain, which is due to axonal injury, gliofibrillary acidic protein or GFAP, is also common during that. Basically, the only thing that they found with the effect of sleep loss is that in response to sleep loss compared to normal sleep, there was an increase in tau. So a 17% increase in tau with sleep loss than there was with normal sleep. This means that we are not draining, where we have more production of tau, and we're also not properly draining with the lymphatic drainage. There were no other changes in the other amyloid beta, but they did find that there was actually a decrease in amyloid beta and GFAP that exhibited just from evening to morning. So basically that across all conditions, that's just something that typical that happens. Okay, so with that picture here, here's what they did, right? They know that Alzheimer's disease has been associated with people that have problems with sleep. And again, there's that lymphatic drainage. So they looked at the effects of the acute sleep loss. We know that reduced sleep duration, reduced sleep efficiency, reduced sleep quality, poor subjective sleep can all affect or can all be common with Alzheimer's disease. And so they're kind of wondering, what is the problem? And so here, again, they had the two condition crossover. They looked at all these labs. One time the young men did normal sleep, one time they did an overnight sleep. Okay, and then they looked at the ratios, and all they found was that increase in tau. And that increase in tau levels in the blood possibly affecting the brain health of these younger individuals due to sleep loss. Okay, so let's bring it all back. So if we know that poor sleep affects concussion recovery. We also know that poor sleep or not getting sleep decreases lymphatic drainage, can increase tau in the brain. And tau is this protein that kind of like it binds up or it blocks proper connections between neurons because it can start to clump and get in the way. Tau is actually a normal protein that is in our cells for good structural stability, but when certain things happen like damage or sleep loss, tau can be released, and too much tau can start to clump and basically prevent proper connections in the brain. And so if we know all this is happening, we know that people with concussions may have poor sleep, may have more increase in tau, which then prolongs this proper recovery from occurring, and therefore it's just going to prolong their return to play, return without symptoms. And so what we want to do is we want to ensure that we are getting good sleep following a concussion. This is where sleep hygiene comes in. Not looking at screens near bedtime, not eating 2 to 3 hours before bed, or ideally 3. Turning off the lights, setting up a good sleep environment that's cool, that's very dark and doesn't have a lot of noise. Also, sleep hygiene, like putting the phone away before bed, so we're not using the phone often. Other things might be taking certain supplements like magnesium threonate. There are many things that we can do for sleep to improve the sleep quality of patients and therefore improve their overall recovery. So I hope you like this one. I think this is really important for everybody to know, because if they have a concussion, we want to make sure that we're sleeping well. So if you have any questions or comments, please leave them below. If you have any suggestions or future topics, I would love to hear them. Thanks again, and have a great day. Stay healthy.